Understanding kidney stones. Symptoms of kidney stones. Kidney stones, also known as renal calculi, are solid mineral and salt deposits that form inside your kidneys. These stones can vary in size, from tiny grains to golf ball-sized, and can cause intense pain when they pass through the urinary tract. Each year, more than 500,000 people go to emergency rooms for kidney stone problems. It is estimated that 1 in 10 people will have a kidney stone at some time in their lives. Welcome back to SF Healthcare, your go-to source for reliable health information. Today, we're delving into a common yet painful issue that affects millions of people worldwide, which is kidney stones. Now, let's talk about the symptoms of kidney stones. If you have a very small kidney stone, you may not have any symptoms as the stone passes through your urinary tract. But if your kidney stone is larger, you'll have some symptoms. If you suspect you might have kidney stones, it's essential to be aware of the signs. Here are the common symptoms associated with kidney stones. Intense pain. Kidney stones often cause severe pain in the back, side, or lower abdomen. The pain can come in waves and may vary in intensity. Some people who've experienced kidney stones compare the pain to childbirth or getting stabbed with a knife. Usually, the pain starts when a stone moves into the narrow ureter. This causes a blockage, which causes pressure to build up in the kidney. The pressure activates nerve fibers that transmit pain signals to the brain. Kidney stone pain often starts suddenly. As the stone moves, the pain changes location and intensity. Pain often comes and goes in waves, which is made worse by the ureter contracting as it tries to push the stone out. Each wave may last for a few minutes, disappear, and then come back again. Painful urination. Kidney stones can cause a burning sensation or pain during urination. Once the stone reaches the junction between your ureter and bladder, you'll start to feel pain when you urinate. Your doctor might call this dysuria. Frequent urge to urinate. You might feel the need to urinate more frequently than usual, even if there is minimal urine production. Needing to go to the bathroom more urgently or frequently than usual is another sign that the stone has moved into the lower part of your urinary tract. The urgency can be accompanied by discomfort or pain. Blood in urine. Blood in the urine is a common symptom in people with kidney stones. This symptom is also called hematuria. The blood can be red, pink, or brown. Sometimes the blood cells are too small to see without a microscope, but your doctor can test your urine to see if it contains blood. The presence of blood may give the urine a pink, red, or brownish color. Nausea and vomiting. Many individuals with kidney stones experience nausea and may vomit due to the intense pain and discomfort. These symptoms happen because of shared nerve connections between the kidneys and the GI tract. Stones in the kidneys can trigger nerves in the GI tract, setting off an upset stomach. Fever and chills. Fever and chills are signs of an infection in your kidney or another part of your urinary tract. In some cases, if there is an infection along with kidney stones, individuals may develop fever and experience chills. Restlessness. The severe pain caused by kidney stones can make it difficult to find a comfortable position, leading to restlessness and constant movement. Painful groin or testicular area. In men, kidney stones can cause pain in the groin or testicular area, often radiating from the lower back. Cloudy or smelly urine. Healthy urine is clear and doesn't have a strong odor. Cloudy or foul-smelling urine could be a sign of an infection in your kidneys or another part of your urinary tract. Cloudiness is a sign of pus in the urine, or pyuria. The smell can come from the bacteria that cause UTIs. An odor may also come from urine that's more concentrated than usual.